Hi guys, it's Sharon with the Trailer Park Homesteader, and today we're going to be talking about personal and medical needs for SHTF. It's not all about beans, bunkers, and bullets. So many times when people think of prepping, they imagine all sorts of unrealistic stereotypes. While yes, preppers do store standard prepping items, when it comes to preparing for their specific families, they must also accommodate family or group members that have special needs. Many of the items needed will depend on the ages of the family members and health issues they have. We've chosen a few different items that our family focuses on and may serve as a good reminder for others. As you look down our list, listen about what items you may have overlooked and make your own list. Some of these, in no particular order, are basic items, and some are required, particularly for our loved ones. Medication. While some natural remedies, herbs, and holistic treatments can work in place of some medications, they simply cannot replace all of them. For many people, medication is one of those necessary long-term items that they will need. One close to home example for us is that our 14-year-old daughter has hypothyroidism, which in her situation, due to the severity, is a life-threatening condition. While there are natural resources that would help maintain her thyroid health, we have yet to find an adequate replacement. The next category is diabetic supplies. If you have a family member that has diabetes, in a SHTF, this would be an immediate concern. One preventative measure that we can all agree on, but would only last short term, is trying to stockpile insulin. According to the diabetes forums, some insulin types, if unopened, can stay refrigerated for up to 2 years. But once it's open, must be used within 28 days. Because the expiration may vary on different types of insulin, make sure that you do your research and ask your doctor for more information. It is also important to know insulin has to be stored at a temperature between 36 and 46 degrees Fahrenheit. In an emergency situation, not only would insulin most likely be severely hard to come by, but it also needs to be kept at the appropriate temperature. And if there's no electricity available, finding other ways to store this would be vital. Another item that we stockpile in our house are denture care supplies and dental care supplies. Something to remember is that some people require the use of dentures, partials, or perhaps a retainer. For those people, thinking ahead and storing up the items needed will be important for their dental care. These products are fairly cheap and easy to store. Another thing to think about, especially, obviously, for the ladies, are washable feminine products. Even during SHTF, ladies will need a method to take care of their monthly issues. Using reusable and washable products may be the only effective way to deal with their menstrual cycles. Products like Glad Rags offer a way to do this simply. Glad Rags are a reusable and washable product that can be used to replace the current disposable products that ladies are using. Another item that is often overlooked is hearing aid batteries. Having the ability to hear clearly is something most people probably take for granted. For many that rely on hearing aid products, this is of the utmost importance. If you or someone in your family is a hearing aid wearer, A good personal needs product to store would be hearing aid batteries. This obviously not only will allow that person to continue using their hearing aid, but it will also help to maintain their personal safety as well. Another item that we actually use in our home is a portable nebulizer. A portable nebulizer is normally used by people with asthma or those who suffer with upper respiratory issues to take breathing treatments. A steroid such as albuterol is placed into the nebulizer and inhaled. Along with the nebulizer, it is recommended that a supply of also prescription inhalers be stored as well, commonly called rescue inhalers. And for our family, this hits close to home because our daughter has asthma, and so those are some of the products that she will need long term as well. Our last item is something that I've never heard anyone mention because they probably don't have a member of their family that is on a feeding tube, but we do. So the last item is feeding tube supplies. Because we have one family member that is fed by tube only, one important prep for our group is making sure we have extra buttons, tubing, and needed supplies that she is going to need. In a SHTF situation, it would be very important to find supplemental forms of nutrition that will continue to sustain her. And this is actually a topic we're continually exploring, because if in the event that something does happen, she's currently on Ensure Complete. That is the only way that she eats, basically. And so we would have to find a way to find something comparable that we would be able to make or acquire to continue to sustain her. So that's always at the forefront of our minds as well. So do you guys have a family member with special medical needs or medical issues? If you do, how would you prepare for them? Little things like this is things that people really need to think about. And I'm sure that if you're a prepper, you already have made, taken steps to involve this in your plan. But if you're new to prepping, just make sure that you're aware of the special needs that you or your family members will need. If you have a family member, for instance, with heart disease or high blood pressure and they're on medication, make sure you look into long-term solutions in case their regular medicine is not available. So if you have any comments, feel free to leave them on the page or email us or come visit us at Facebook. Talk to you later.